Hey guys, how's it going? I want to quickly discuss about positive urine culture report. Do you have any elderly family members that are living in nursing homes, and have you known them to be going back and forth to the emergency room? If they took a fall or they are having confusion and stuff like that, frequently they're all sent to the emergency room. And then, I've known a lot of patients to end up with, urine culture checked every time when they're in the emergency room. Because urine infection can cause confusion and falls in the elderly in nursing homes. So because of that, the ER physician might be checking their urine analysis and culture. Not every time they should be checking culture. They should first start with the urine analysis, and if that is positive, then you do the culture. But nowadays, accidentally you find a lot of patients who get urine culture reflexively checked automatically. And then you find that, they got some bacteria growing in the urine every time. And then the question is, are they having urine infection, on a monthly basis, or is it just a colonizer? Did you know that bacteria can colonize, your skin, which is very common, like your gram-positive bacteria, like staph. And then gram-negative bacteria, which comes out of the poop, and that can be colonizing in and around the urethral orifice. And then it can even colonize inside the bladder. And by the way, urinary tract consists of the kidneys, and then your ureter, your bladder, and then your urethra. So it's got a lot of parts to it. The commonest place where infection happens is the urinary bladder. But within the urinary bladder, you may end up with just bacteria that have just colonized. Did you know that? So it's a complex problem. That's where, we need to be a good clinician to figure out and put together and look at the big picture and not just at that tree. You got to look at the forest as the whole. Are they having symptoms like fever, burning urination, or other symptoms? Are they having positive nitrite in the urine? Because bacteria in the urine, like true infection, would convert your nitrate in the urine to nitrite, so it'll be positive. And then do they have a lot of, epithelial cells in the urine? Because normally urine should not have epithelial cells because those come from the skin. So when you're obtaining urine culture, and if it's contaminated, it's going to end up with a lot of epithelial cells. So we got to, look at a lot of things to figure out if it's a true urine infection or not. And urine infection would need to be treated with antibiotic. But if it is just a colonizer, then that does not need any treatment. And there is a condition called as asymptomatic bacteriuria, which means you're just peeing out a little bit of bacteria in the urine. And that doesn't need any treatment with antibiotic. Because a lot of recurrent antibiotic treatment by itself can be dangerous because it's going to cause diarrhea and a lot of other problems. I hope this helps, okay? This is a complex topic, but we just approached just little aspect of it right now, and we'll keep talking about these things in the future. Talk to you later. Goodbye.